In this video, I'll be assessing the heart and neck vessels. I'll start out by looking at the neck vessels first. I'm going to have my patient turn his head to the right for me. This will extend out the jugular vein, which is allowing me to see if there's any pressure built up. And also looking for any thrills, any abnormal pulsations that you might see. And with him, I don't see any, and there's no jugular vein distension noted. While I've got his head turned that way, I'm going to auscultate with the bell of my stethoscope the carotid arteries. And here I'll be looking for any blowing or swishing sounds known as a brew. Okay, if you'll hold your breath for me. Okay. No bruits noted while I was auscultating. Next, I'm going to palpate the carotid arteries. Okay. All right. They're palpable and they're equally strong bilaterally at a rate of 2+. No variation in strength from beat to beat, and no thrill was palpated. Next, we'll move on to the heart. I'll start off by inspecting just to see if I see any abnormal pulsations through his shirt. No abnormal pulsations are seen. Next, I'll palpate the apical pulse at the mitral area, which is between the 4th and 5th intercostal space, mid-clavicular line. Okay, I'm able to feel it, but just faintly. And in patients, sometimes it's not palpable. You'll have to ask them to roll to their left side, and you can place your palm right there on the mitral space, and you'll be able to feel a slight pulsation. Next, I'm going to auscultate using the diaphragm of my stethoscope at the apex of the heart, which is also known as the mitral area. Looking for rate and rhythm. S1 and S2 are audible there. We've got a regular rate. A normal adult rhythm would be 60 to 100 beats per minute. And right there at the apex of the heart, the S1 is usually, it's heard louder at the apex, as S2 is more audible at the base of the heart up here, where the pulmonic and the atrial, or the aortic sounds will be heard best. And I'm going to go through the sequence of listening to the aortic, the pulmonic, Erb's point, tricuspid, and the mitral, using the diaphragm and the bell as well. Okay, going to start off with the aortic. And the aortic is on the right side, the 2nd intercostal space. Move until the pulmonic. Here at the base of the heart, like I said, the S2 is heard the loudest. This is at the 2nd intercostal space on that left side, left sternal border. Moving to Erb's point, which is 3rd intercostal space. Down to tricuspid. And over to mitral again, which is the apex of the heart. S1 is heard the loudest here. Okay, and now I'm going to use the bell of my stethoscope to listen to the sequence again. Okay, aortic, pulmonic, Erb's point, tricuspid, and mitral. All while listening, I was assessing for any murmurs or extra heart sounds, and none were audible with him. Last but not least, I'm going to have him sit up just a little bit for me, leaning over slightly. As he exhales, I'm going to use the bell of my stethoscope just to listen at the apex of the heart again, known as the mitral valve area. Sometimes in the supine position, back when he was upright, murmurs are not clearly audible, so this being upright and exhaling will allow me to hear that if there is any. Okay, exhale for me. Okay. S1 and S2 are present, and there were no murmurs or extra heart sounds audible while I was listening to him in the upright position. All right, is there anything else I can do for you? Okay, thank you.